Hello, everyone. And this Wednesday, we're discussing prediabetes and diabetes and things that can help to keep the blood sugar in the normal range. So prediabetes and diabetes are very common, and you hear about it a lot because a lot of people that have it don't have symptoms, and that's a scary thing. And especially in the early stages, you may not know at all that you have it. Meanwhile, it's causing a lot of damage to the body. The other problem with prediabetes and diabetes is that it's not only, especially when the blood sugar is uncontrolled, it's not only that it can lead to serious health conditions like heart disease and strokes, it's also that the quality of life of the person can be greatly affected, even if it doesn't hurt you and that even doesn't, cause death. It can still make people very miserable. It can lead to blindness. It can lead to nerve damage. It can cause kidney failure. It can allow people to have serious infections that lead to amputations of their limbs. So diabetes can be very, very serious. And so that's why you hear about it a lot. And it's important that it's controlled. So you're listening to Connecting the Dots with Dr. Ashaye. I'm Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care in Sugar Land, Texas. And here we offer stress-free healthcare with direct access to the doctor so our patients can get the care they need without the inconveniences or delays in the traditional healthcare system. You can learn more about our services on our website, www.intouchprimarycare.com. And if you've not already subscribed to our YouTube channel, please go ahead and do that. It helps us to get the word out. Okay, so let's get into it. What is prediabetes and diabetes? So prediabetes is when the fasting blood sugar is between 100 and 125, and then diabetes is when it's over 126 or 126 or higher. And that's after fasting for about 8 hours. So nothing to eat or drink except for water. Most people do that blood test in the morning. Diabetes can also be diagnosed if the random blood sugar, so this is after you eat, 2 hours later, we check your blood sugar is over 180. Or if your A1C, which is more commonly tested these days, is 6.5 or more. So prediabetes is when your A1C is 5.7 to 6.4. So we look at all these values and determine where you are, whether in the pre-diabetic or diabetic range. What's happening when, we say that the body has too much blood sugar? Well, there are two main things. The first one is the body is resisting the action of insulin. So when you eat, glucose goes into your bloodstream. That glucose is supposed to get into the cell, and that's how you get energy. People that have prediabetes or diabetes, when they eat, the glucose gets into the bloodstream. However, the insulin that carries the glucose into the cell is either not adequate or not there, and so the glucose gets stuck in the bloodstream. And so what happens is the blood sugar is high. So when you check your blood sugar, you can actually say there's too much sugar in the blood. So in people that have prediabetes or diabetes, one of the things that's happening is your body's resisting the action of insulin. So you may even have insulin, but your tissues are not accepting the insulin. It's not allowing the glucose into the cell. And that could be because of inflammation. The other thing that could happen is that the beta cells, so there are cells in the pancreas called beta cells that are supposed to release insulin to help your body digest or get the glucose into the cells. Well, those beta cells are affected by high blood sugar. So it's kind of like, your blood sugar is high because you have diabetes, but that high blood sugar is affecting the cells that produce the insulin that will get the blood sugar lower. So it makes it a little bit difficult to control. But there are things we can do about it. The first thing that we can do about it is not to ignore it. And this is really, really, really important. It's so important to check the blood sugar as often as needed, depending on where you are in that spectrum. If it's normal, you want to check yearly. If you have prediabetes, you want to check at least yearly, depending on where you are in that range. Like if it's close to diabetes, you may want to be checking more frequently. But it's so important because that decline of the beta cells I talked about, it can actually be slowed or even reversed, especially when checked early. So when prediabetes is checked early, it can be, it's caught early, or even early diabetes can be reversed. So it's so important to check and see, because like I said, many people don't have symptoms. So that's the first thing you can do. The second thing you can do is change how you eat. And a lot of us have heard about, if you have diabetes, don't eat too much sugar. Many people know that. But it's actually as important that you do eat. The type of carbs you eat are important. So you want to eat carbs, but the carbs you eat should be from fruits and vegetables. Not all fruits will be fine. You have to check with your doctor if you're already diabetic, but you want to get a lot of vegetables in because that will really help. And then you want to do whole grains in terms of carbs. So you want to substitute for processed carbs with whole grains and fruits and vegetables as much as possible. And this is because processed foods tend to have a lot of sugar, fat, sodium, which causes more inflammation and affects, the way your body uses glucose. The other thing about you want to do with fats is you want to limit saturated fats. So you want to limit things like red meat or meat in general has saturated fat, baked goods, cheese, desserts, things like that, fried foods. And then you want to substitute that with polyunsaturated fats like cold water fish, like salmon, mackerel, tuna, sardines. You want to do more nuts and seeds, flaxseed, chia seeds, walnuts, and you want to do healthy oils. So you can get fatty, you can eat fat, you can eat carbs. It just depends on what kind that you're eating. So that makes a big difference. And then you want to get enough protein as well. In terms of protein, it's better to substitute animal protein with plant protein. So you want to do more peas and beans, including like kidney beans, pinto beans, white beans, black beans, garbanzo beans, all beans. Okay. So you want to do a variety of beans, and instead of getting your protein from meats. And again, that will help address the inflammation that occurs with people that have insulin resistance. So one thing that could be helpful and that I have incorporated with caring for some of my patients that have prediabetes is continuous glucose monitoring. And that is for them to check their blood sugar, even if they're not on insulin, just to check their blood sugar 2 hours after they eat, just to see for them what raises their blood sugar. And so, doctors can prescribe the monitoring device that is used. And that's something that has been helpful because then they can see for themselves, when I eat this and I check my blood sugar 2 hours later, my blood sugar shows this. And it tells them, it helps them decide what to eat and what not to eat. So that's a tip. Now, another important thing that people with prediabetes, diabetes, or at risk of in either of those conditions can do is emphasize or prioritize regular physical activity. And the goal is to get to 150 minutes per week, but start out slow. There was a meta-analysis of over 300,000 subjects, and it involved over 300 controlled trials. And what they found is they compared mortality outcomes of people that were taking medications versus people that were exercising. And what they found was that exercise was actually better or as good as medications for several conditions, including prediabetes. So exercise is so important, can really be used as a medicine to help reverse prediabetes. And so it's important to incorporate exercise in your routine. And the last thing I'm going to talk about is sleep. So sleep is so important, and especially for those that have metabolic conditions like prediabetes or diabetes. When you don't get adequate sleep, there are a few things that happen. Number one, the muscles don't take up as much glucose, so the glucose stays in the blood. Number two, your beta cells are impaired and it doesn't secrete as much insulin. So again, the insulin is supposed to help the glucose get out of the blood into the cell. If your beta cells are not secreting enough of the insulin, then the glucose stays in the blood. The other thing that happens is the insulin that is secreted doesn't work as well. So the tissue does not accept the insulin quite as well when you don't get enough sleep. And then on top of that, your liver, the output of glucose from your liver is enhanced. So basically, impaired sleep leads to people needing more insulin. So people that have diabetes, when they're not getting enough sleep, they tend to need more insulin than when they get adequate sleep, which is about 7 to 8 hours of sleep daily, of restful sleep. So sleep is important. So I would encourage, everyone to, these are lifestyle things that you can do to help keep glucose in the normal range. You can start by adding something to your diet if you haven't already, started eating a healthy diet. You can snack on physical activity, just do 10 minutes daily to start out with a goal of 150 per week. And prioritizing sleep is really important as well. Again, always check with your doctor to see what the best course of action is for you. So if you're in the Houston area, though, and you're looking for a doctor that is proactive about your health, well, we're here for you at In Touch Primary Care. You can learn more about our services and how we can help you on our website, or you can call us at 713-280-9985. So imagine you have, there's so many benefits of controlling your blood sugar this way. And that's because when you make lifestyle changes, just apart from preventing serious health conditions, you have a better quality of life. You actually feel better overall. And that's why I like this approach of making sure you do all you can with lifestyle before looking to medications to treat your conditions. If you know anyone that has prediabetes or diabetes, please share this episode with them, or if they even are at a risk of prediabetes or diabetes because of a family history, go ahead and share this with them. And that's what I have for today. I hope that helps. I will see you next week at the